Are you aware that thyroid cancer is very common and it is more common in women than men? Hi, I'm Dr. Shilpi Sharma, a thyroid cancer and head neck cancer specialist at Max Hospital, Dwarka. Thyroid gland is the gland which occupies the front of the neck. So any cancer which develops in it can present as a thyroid swelling. In fact, most of the time it presents as a swelling in the front of the neck alone, and there are not many symptoms associated with it. Majority of the time there is no pain, and pain occurs only in advanced cases. Sometimes it may present as a change in voice because it infiltrates the nerve which is responsible for the voice production, and this happens in advanced cases. And in advanced cases it may present as a difficulty in breathing as well. Occasionally, only symptom is swelling in the lymph glands at the side of the neck, not in front. And when we actually look for it, when we diagnose it and try to rule out the cancer, we find that actually the cancer is from the thyroid. And after all, there may not be any symptom in the thyroid, and sometimes it is only detected when we do an ultrasound or PET-CT for some other reason. Now, how to diagnose thyroid cancer? The first and foremost initial investigation of choice is ultrasound of the neck, where we try to differentiate a normal nodule from a cancerous nodule. And once we suspect that there could be a cancer in the thyroid nodule, we order FNAC, which is a fine needle aspirations test, in which what we do, we put a small simple needle and we just aspirate few cells, and our pathologist examines it under microscope and try to differentiate a thyroid goiter from a thyroid cancer. At times, it is confusing and they cannot make the diagnosis on FNAC. In those situations, we may have to do surgery to diagnose whether you are suffering from thyroid cancer or not. Once we are suspicious of thyroid cancer, we need to determine the extent, for which we do either CT scan of the neck or we do MRI. PET-CT is not a great investigation in classical thyroid cancers. However, it is sometimes needed. So, important thing to remember is that thyroid cancer can present as a simple goiter. So, best is not to ignore it and get it investigated. Thyroid cancer has excellent outcome if detected early and treated well in time. Thank you.